when someone has a paralyzed diaphragm, they have a lot of disability when they're breathing. So for a young person, it could be difficulty exercising, difficulty sleeping, trouble walking upstairs, trouble bending over and tying their shoes. So you're 40 years old and you feel like you're 90 years old.
Welcome back to our next episode of
Unfilter It
with Lindsey
and China.
Today we have an extremely special guest. Well, actually two. We have a special guest and then he brought a special guest for some fun. So this is Dr. Matthew Kaufman, guru of all things phrenic nerve, has the best posture in America. So tell us a little bit about yourself and
Thank you so much, Lindsey and China. So great to be here. And we'll get to meet Dr. Jarrahy in just a couple of minutes. But first, I'd like to say that I think what you guys are doing is phenomenal. I think this is an amazing podcast. I also think that for people that don't know, that Lindsey and China have an amazing aesthetics practice in New Jersey here. And they are the top of their game, top of their field. I'm so happy to be affiliated with them. So happy to be here today.
Oh, thank you. Oh, well, we love that. Thank you for coming on. It's like really important for us to have special guests come on and like talk about the real of plastic surgery and what it's all about, because I think that, you know, lay people don't really understand our intricate world of webs that we spin.
Agreed. And I also like to talk about everything that our practice does for peripheral nerve surgery because people even know less about that. So I think it's a good way to get to the general public, you know, other than people just searching on the web if they have injury or I can't breathe or something like that. So let's start out with some phrenic nerve things. If you don't know what the phrenic nerve is, Dr. Kaufman will talk to you about that a little bit right now. And I really just want to very lay terms. What should someone do and what would their symptoms be if they had a phrenic nerve injury?
Well, the first thing to talk about is that in the realm of plastic surgery, there are things that we take care of that most of the public doesn't really understand or understand why a plastic surgeon would be dealing with it. So the condition we're talking about is called diaphragm paralysis, and it's a paralysis of the breathing muscle. And so when someone has a paralyzed diaphragm, they have a lot of disability when they're breathing. So for a young person, it could be difficulty exercising, difficulty sleeping, trouble walking upstairs, trouble bending over and tying their shoes. So you're 40 years old and you feel like you're 90 years old. The most common reason that happens is an injury to the nerve that controls that muscle. It's called the phrenic nerve. And so every muscle in the body has a power supply, and the power supply to the diaphragm muscle is the phrenic nerve. And diaphragm paralysis is one of those things we call, or I call, an orphan condition. And that means that it falls between the cracks. So it's not that common, number one. Number two is not really many doctors know about it or take care of it. And number three, that means that the treatments traditionally haven't been that good. And so in the realm of reconstructive plastic surgery, we deal with nerve problems throughout the body. The most common thing being carpal tunnel, you know, when your fingers go numb, or when someone's in an accident and their arms paralyzed or their legs paralyzed, or Dr. Jarrahy, you can talk about Bell's palsy, which is facial paralysis or paralysis of the facial muscle. So this is just another example of a nerve being damaged, causing a dysfunction, and in this case, it's a dysfunction of the breathing muscles. And there are thousands of people out there with this. On the milder end, it would be people that maybe have either an acute injury to their neck, or maybe they have a job where they're constantly beating on their neck, or maybe they play contact sports as a youth and they've been in some car wrecks, and it just suddenly pops up, and it creates this dysfunction. All of a sudden, you take an active person and they just have trouble walking upstairs. On the more severe end would be like a Christopher Reeve situation where someone's in a horrific accident, they have a spinal cord injury, and now they're on a mechanical ventilator where they can't even breathe on their own. And we're able, in some cases, to do surgery, reconstructive surgery, to get them breathing independently again off of the ventilator. So it's a wide spectrum. It's not that common, but there are thousands of people out there, and we've really developed over the last 20 years the International Center of Excellence, really almost one-of-a-kind type of center.
So, Dr. Kaufman, what made you get into repairing phrenic nerves?
So the amazing thing about our practice, we're all in here, including Dr. Jarrahy now in our Los Angeles West Coast affiliate offices, is that we're not just, one-track surgeons, one-track plastic surgery. We do aesthetics, we do general reconstruction, and we also do very specialized surgery. So that's what appealed to me when I was looking for a job 20 years ago, that this practice had all of these opportunities to flourish, to innovate, because I think a lot of this is related to innovation. And so I wanted to be able to do all these things. And certainly when you do something like phrenic nerve surgery, you have to focus on it to do it well.
Sure.
Because you're creating something from really nothing. But I really like taking the techniques that we learned dealing with other types of nerve injuries and now applying it to help with a new problem that people are out there and they're being told by physicians, and I hear this on a daily basis, sorry, sir, sorry, ma'am, you have this paralyzed diaphragm and you're going to have to learn to live with it. And so, the goal really is to say, no, you don't have to learn to live with it. We can improve quality of life, improve function, and really the dogma of reconstructive plastic surgery is restoring form and function. And that really, this model of diaphragm paralysis, phrenic nerve surgery fits perfectly into that, restoring form and function. And we all do that in one way or another, whether it be with the aesthetics, the general reconstruction, or the specialty surgeries that we're talking about here.
All right. I think we need to talk a little bit about some diaphragm pacemakers, because I remember when I started back with the company, oh my God, what was it, 2008? Well, I remember we would be in St. Peter's, we'd be releasing these phrenic nerves, and then you kind of started with the diaphragm pacemaker. So talk a little bit about that, because he's minimizing how great he
I was
is
just
doing.
going to say, so when I came to this company, during my orientation, there was like this whole presentation about how we have like state-of-the-art, one-of-a-kind surgeons, and you're one of them.
Yes.
Because Dr. Kaufman's being very humble. He's like one of one in the whole country, right, that does this procedure. He's very prestigious guy right here.
Yes, he's one of the
he's kind of keeping it in.
globe. But he is getting patients off of ventilators, which is huge. I remember my mind was blown when I was young and in my 20s, and I was like, what? What are you doing? Because you're young. I didn't really totally understand it all. Even if you're getting someone off just for a couple hours, they can go to the food store, they can go see a show without having to bring, oxygen with them or all of that.
Very stands out in my mind for this because, I have a background as an ICU nurse, so I automatically assumed that anybody that had this phrenic nerve condition was on a ventilator. I had no idea that it could be just the regular athlete or football player or track runner or whoever it is that can have a subtle injury. How many of us have been rear-ended and have, neck injury? You have no idea.
Right. So spinal cord injury, which, coming out of plastic surgery training, we really don't get much exposure to that. It's almost like on an island when you're dealing with the spinal cord patients. And even in a lot of hospitals, there's not a lot of comfort dealing with that or understanding that. And so when I started exploring the depth of phrenic nerve surgery and diaphragm paralysis, I almost didn't even realize this whole component of spinal cord injury and ventilator dependency. And then when I started immersing myself in this field with going to conferences and meeting people, high-level people that were dealing with this, immediately I said, we have to figure some stuff out here because it presents an opportunity to help these most vulnerable individuals. Think about the statistics of spinal cord injury. It's mostly young 20-year-olds with diving accidents or bad motor vehicle accidents. We've even had children as young as 5 years old.
Wow.
There's some other conditions, neurologic conditions where even kids, almost like now there's a new polio virus that's affecting children called acute flaccid myelitis, where they develop the same kind of picture as spinal cord injury. So now we're seeing children under 10 that just one day have a virus, and that they stop being able to move their limbs and stop being able to breathe. And so I explored, this diaphragm pacemaker, which is essentially an electrical stimulator for the diaphragm. So in a spinal cord injury, you lose the ability to control your diaphragm muscle. So your brain is trying to send a signal to breathe, but it doesn't get there because of the spinal cord injury. So implanting wires into the diaphragm or around the nerves, the phrenic nerves, can offset that, lead to a muscle contraction, and then allow the patient to breathe. And so instead of a mechanical ventilator, which is essentially blowing air into the person, kind of like strong positive pressure, this is more physiologic, because when we breathe, it's negative pressure. We're kind of sucking air in, and that's what the diaphragm pacemaker does. So we've implanted, a few hundred patients in the last 20 years, and we really become the be-all, end-all referral center, because there are a lot of centers around the country and around the world that implant these pacemakers, but there are scenarios where that's not enough. The injury requires, in addition to the pacemaker, some of the complicated nerve reconstruction techniques. And so we're sort of the referral center of a referral center for those most complicated cases. But we actually just recently have reviewed, we've published a lot of this because it's so important to get the word out to the medical community that this opportunity exists. There are lots of facilities out there that don't even know that this option exists. If their loved one becomes ventilator dependent from a spinal cord injury, that they think that's it.
Right.
That the rest of their life, they're going to be confined to this big machine, and they're never going to have the, ability it's going to make it harder to speak and to eat and to get around. And so when you get someone off a ventilator, it's not just that they're breathing better, their whole life changes. And also they live longer, because the number one killer of spinal cord injury is respiratory infection.
Yeah.
And that's because of being on a ventilator. So there's so much value there. And it's really, that segment is the most rewarding thing that I do, because to help these 20-year-olds to be able to breathe again, it's still very sad because they can't move their limbs.
Right.
And that may be on the horizon, but at least we can help them with one major deficit.
Which is a huge piece of quality of life, which I know we'll get into later.
Yeah.
It's my favorite topic.
Yep. Let's see. What
Shall we introduce?
Yes.
Let's introduce the, maybe I can introduce you.
Yeah, please.
So we have a very, very special guest today. And I'm so happy to have him on a video link all the way from Venice, California. This is a friend of mine, my best friend, and I've known him for 20 years plus, and we met in training. And he's, it's kind of like when you meet, you have your friends from the trenches, right? And that that they have your back. It's always important to have somebody that's got your back in this world, right?
That's for sure.
And this guy, through thick and thin, I've had his back, and he always will have my back.
Who's back more?
Now, he happens to be a world-class plastic surgeon in the specialty of craniofacial surgery, which means that he operates on children with a lot of with congenital issues, and he also now has branched out into facial feminization surgery. But he is an expert. He trained with the top people in the world. He's been in practice in LA for almost 20 years. He is the president of the American Society of Maxillofacial Surgeons, which I know he'd want me to say, which is an esteemed organization of these craniofacial surgeons. And
I don't want to hear any of this.
You're gonna, yeah.
And he also volunteers several weeks a year to go and do pro bono charity work in Guatemala, which he's been doing for many years. And he has a high level in that organization and in helping develop the healthcare facility down there and running it. And he's helped hundreds and hundreds of children in Guatemala. So Dr. Reza Jarrahy.
Yay! Thank you for being on our podcast episode.
Thank you for
Is
coming
there,
on
you
at
guys,
7
you guys
a.m. his
pipe in
time.
like applause in the, in the background when you in post production. Wow, thank you, Matt. Plastic surgeons in general. I don't know, we're a quirky bunch and we sort of love to hear our own accolades. I really don't like it, and I get a little embarrassed when I hear, someone like Matt say things like that about me, but I do appreciate it, Matt. And I want to thank Lindsey and China for not only having me today, because it's nice to do these sorts of things, but also going back to something that Matt said. I'm coming to you from LA, although this is my Brooklyn loft that's housed within my kitchen in LA, thanks to digital magicry. When I was in the office in Jersey last month and I came by and saw your guys' outfit, I was so impressed because plastic surgery has become, what people know of plastic surgery is what they see online, on television, and other sort of maybe not so real sources. And the fact that housed within this really impressive practice that's focused on some of the most advanced reconstructive surgeries that are being performed in the country is this aesthetics practice. And just the fact that you mentioned you were an ICU nurse, it tells me that you all bring sort of a really serious background to what you're doing, and you're providing patients there with a holistic approach, so they can be downstairs seeing in a consult for breast augmentation or facelift or something, and come to you for an aesthetic rejuvenation or procedure, but all within the context of a practice that's focused on really improving people's lives. And I know Matt and I have a holistic approach to plastic surgery that not only includes changing one's external appearance, but also one's internal appearance, and focus on wellness writ large, not just how we look. So kudos to you for bringing this into the practice, and now using this podcast as a mechanism to sort of educate people. And the only thing I want to say otherwise is, Matt, Dr. Kaufman is really, he's sort of the anti-plastic surgeon, because whereas a lot of people in this day and age of social media and Instagram and TikTok and all this stuff, relentless self-promotion. Matt Kaufman is a guy who just puts his head down, who really, he's not one of one in the country. He literally is one of one on the planet. I think I can say without exaggeration that there's no one else who's doing this surgery. Matt had this idea. He had this skill set, and the actual skill set required to do this phrenic nerve surgery is not unique. It's sort of their microsurgical techniques and using fine instruments and loop magnification or a microscope, and it's peripheral nerve surgery, and plastic surgeons have been doing that for decades and decades. But the application of it to this problem, which as Matt described is an orphan problem, there has been no real answer. A lot of patients just hear, sorry, there's nothing we can do. We can try diaphragmatic plication, we can try pacemaker if it's indicated, but otherwise, we have no help for you. Matt created this field, and now, like close to 1,000 patients later, with over 85% success rate, he's getting referrals from all over the world. And we hear that, there's someone here trying it in this center after reading some of his publications, and someone trying it here, maybe with plus minus results. And so that to me is true innovation, really what plastic surgery is all about. So, and yes, he also happens to be my best friend, and I love him. And every time I come to New Jersey, I feel like I have a home there. So it's really been a privilege and honor for me to be involved with Matt, and he's teaching me how to do these phrenic nerve surgeries so we can expand the program on the West Coast to alleviate the patients of the burden of having to travel to New Jersey if they're on the West Coast and so on. So long story short, and Matt will tell you that I spin a long yarn, but it's really an honor to be here with you guys and to have been Matt's dear friend for so long and to be involved in his work.
And I should mention that in 2013, we set up a program, a sister program at UCLA with Dr. Jarrahy, with Reza, both to be able to take care of patients on the West Coast and for us to have some, riffing together in the operating room at UCLA like the old days, but mainly to help patients from the West Coast rather than having them travel there, and then to have a great institution like UCLA be able to provide another home for us. And we are slowly developing other centers where we can reach out to folks and save them a trip. Because even though we all love New Jersey, not everybody is so eager to travel here, especially in the winter.
I don't want to travel here in the winter.
It's also like I feel like true innovators, like even if you think throughout time, like have a creation and then like leave a succession. So it's like nice that you're spreading it to the West Coast and have it here on the East Coast. And then also like, down the line when you decide to retire, someone can continue on this work. Yeah.
China and I are really huge on community over competition, and this really shows it throughout our practice, throughout the country. There's patients that are flying in from outside our country to see these surgeons as well. So I think it's great to have it on both East and West Coast, so it's really obtainable for patients to come here.
I just want to jump in and say, in terms of, innovators historically, it's rare that a true innovator is just welcomed and their work is accepted. They're often challenged, and we're seeing that too. Insurance companies are saying, despite having done almost 1,000 cases, they're saying this surgery is experimental. I think Matt has gotten some flack from members of the neurological community, the pulmonary community, that this is sort of, an aggressive type of procedure. And again, a testament to Matt's character. Instead of engaging on those fronts, results don't lie. And I'll say another thing about Matt is that he's one of the most ethical and above board and sort of highly moralistic people I know. And so when we publish a paper describing our results, that's hard data, and you just can't argue with results. And that's been the approach. And people, I think, are slowly, I don't know if it's been your experience, Matt, over the past decade or more, people are slowly coming around. So the original naysayers are now like, oh, I'm going to send my patients to Kaufman because this is a legitimate thing that he's doing.
That is innovation in general has to be done, in my opinion, the right way, right? In our field, a lot of people are pushing things that maybe haven't been vetted properly, right? Or in the aesthetics field, every other week there's a new product and they're marketing it before they maybe know how good it is, right? And isn't that sort of backward logic? And then that technology might not be around in 6 months because there's going to be a lot of unhappy patients. So especially, this is a philosophy that, traverses reconstructive or aesthetics, in the world of phrenic nerve reconstruction, diaphragm paralysis. It had to be done the right way because you're creating something from nothing. You're going to be up against a tremendous amount of scrutiny from all angles, from the public, from other physicians, from insurance companies.
Sure.
And so it has been a battle. It's still a battle. And, some wise old physician once said, well, it takes 30 years in medicine to make, meaningful changes to standards. And we're 20 years in, but,
30 years,
I won't keep fighting. But it like Reza said, the proof is in the outcomes. We like to let the patients do the speaking. So we have hundreds of videos of patient testimonials and the experience of these particular patients, and Facebook groups and online things, and the patients bring in the other patients, right? At this point, because they say, oh, there's another person out there like me with this problem. And then they look at the research, and then they look, then they're able to tie it all together, and that's, I think, the best way to innovate, in the medical field. So.
On that note, as far as frustration with insurance reimbursements or approvals or whatnot, I think this touches on what Lindsey and I, and even you, Dr. Kaufman, were talking about in the longevity realm of things and prevention of diseases. It is more and more difficult to have commercial insurance companies approve things that are meant for prevention. Certain medications that are out with good science backing them. Testing that's been recommended that has no insurance coverage because it's considered experimental. So maybe we can just touch on, before we go into part 2 of this episode, maybe we could touch upon your opinion on that, on prevention and.
Right. Well, prevention, and we'll get into the whole wellness thing, but I think prevention and preventive medicine is key. It is underutilized in the American medical system. We're treating disease. We're not preventing disease enough. Even though I'm dealing with patients with a particular disorder, it doesn't mean I can't talk to them about these things, because it may help their overall outcome, and they're looking to me for guidance on how they can just get better. So prevention is obviously part of that. And in general, just I have an interest in prevention. So as far as, how should insurance companies go about it? How should we go about it as physicians and medical providers? Look, I still think the science and looking at risks and benefits, the Hippocratic Oath, first do no harm. So you never want to harm somebody.
Right.
I was listening to a podcast yesterday talking about biohacking, and I don't know if you know what really that involves, but that is taking a boatload of things that have not been fully tested or vetted and almost experimenting on yourself, because maybe there's been some animal studies or some limited things, and some of this stuff is very expensive, right? And so it's a huge industry. And the question is it going to harm some people? And also, is it saying you need to spend $100,000 a year on supplements or medications in order to live a long life or live a healthy life? And so I think that's a really bad message, right?
Right. Yeah.
But I think there are things out there that, are safe, or maybe drugs that have been out there that can be repurposed, things like that. Drug companies aren't interested in that because there's no money in it, right? So there are probably many things that could be studied and repurposed that we know are safe because the drugs have been around forever. Right now, one of the big ones that they're looking at is metformin, right? So metformin, there's a huge study right now because there have been some mixed results in the literature about whether metformin in a non-diabetic, metformin is a diabetes medicine, but it's been shown that it could prolong life or help improve health in the long run. And so they're doing some large studies, and that's a drug where we know it's safe in diabetics. For years it's been out there, and maybe, if they really confirm that it either prolongs life or improves wellness or health span, as they say, the amount of time you live in a healthy way, that maybe it should be prescribed and maybe it should be covered as a drug for, longevity and wellness. So that's just one example. But certainly if we're able to do that, and you could have people living longer, preventing chronic disease, cancer, diabetes, heart disease, neurodegenerative disease, I'm all for that. Yeah. But it has to be first do no harm, and the benefits outweigh the risks, and studies that show that those two things are the case.
The four horsemen, as it's been termed, right? Well, I think that this conversation needs to continue in part 2. So if you want to hear about the wellness portion, I think you got to tune in to our second episode with Dr. Kaufman and Dr. Reza, and stay tuned for the next episode of
Unfilter It with Lindsey
and China.
See you then.